everyone. I'm Amanda Olson from IntimateRose.com, and I'm joined today by my amazing colleague, Alicia Jeffrey Thomas, also a pelvic health physical therapist, and we are talking about tools to empower our patients to manage sensitive pelvic health issues. And Alicia has been such an amazing advocate, and we're just going to go through the products and talk about what they are and how we each use them individually in clinic with patients. So the first one is the lovely vaginal dilators. Our vaginal dilators are FDA cleared and come in 8 different sizes to provide a gentle stepwise progression. And Alicia, I know that you love our dilators so much. How are you using these and recommending these in clinic?
Yeah, so I mean, I have a lot of patients that I use these with varying diagnoses, everybody from vaginismus, which is that like anticipatory muscle contraction that basically makes entry difficult, all the way up through people who are experiencing maybe some like genitourinary syndrome of menopause, some pain with intercourse as we move through that menopausal process. And so there's lots of different ways that you can use the dilators. Obviously, the most straightforward is, moving through the different sizes, and basically being able to say, okay, can I insert this size? Is there any pain? And then, moving up through each one progressively until you get to whatever your goal is, whether that's being able to tolerate using a tampon or having a speculum exam. Exactly. So some of the smaller ones for some of those goals, and then up through, if you're trying to achieve entry with a penis, then you might have something that's a little bit on the larger end of the spectrum. But again, not having to go any higher than whatever your goals are. So it doesn't necessarily mean that you have to go all the way up to number 8. And then within the specifics of that, depending on what's going on, you can have people use the dilators as kind of a way to provide a little bit of gentle stretch to the tissue. So you can take the dilator and kind of walk it around exactly. And apply pressure in different directions if they have specific areas of tension or scar tissue or other types of restriction there. You can be doing different nervous system down training techniques. So diaphragmatic breathing, doing other types of like fascial work to the abdomen or the inner thighs while you have the dilator inserted. I'll oftentimes have people do different types of motions with their body. So, whether that's doing like some like legs moving side to side, kind of like windshield wipers, or marching with the dilator inserted, it kind of gives that signal to your brain of like, hey, I'm in charge of what my body's doing right now. And so that allows the pelvic floor muscles to feel like they have more control over relaxing, in addition to just getting different types of stretch and desensitization.
Love it. And we also made a very lovely handle to provide a little extra reach for people that need the assistance with the actual reach itself, or maybe they need a little bit of emotional distance from their body as they're exploring and learning how to use the dilator and learning their anatomy, or if there's anyone with dexterity issues too, certainly we can load the dilator for them and they can take it home and be using the wand either with an anterior approach or a posterior approach, in side lying or hook lying, supine. Lots of different creative ways to change body position as you were discussing. And then we currently have one water-based lubricant, and we are getting ready to launch 2 more lubricants this year. We are so excited. Another water-based lubricant that's going to have a little bit of a thicker consistency and be free of all of the toxins and amazing. And then we're going to make a silicone-based one as well that isn't necessarily meant to partner with our silicone-based products, but is going to be great for intimacy and personal use. So water-based lubricant with our medical-grade silicone products, and then silicone-based lubricant for extracurricular activities. And then we also have our organic balm that is staying the same, because don't change something that's amazing.
I was going to say that is such a great product. Yeah.
We're so proud of it. And it's been a game changer for a lot of different patient populations, including postpartum in that low estrogen state, people with lichen sclerosis or dryness and sensitivities, or in the perimenopausal, postmenopausal state. Yeah, we go out of this quick. We work really hard to keep this in stock. But piggybacking on our vaginal dilators are our rectal dilators that also come in 8 sizes. They feature a bit more flexibility in the silicone to respect the rectum. And they
Mhm.
go up through the 8 sizes. And again, with the goal point being specific to the patient. But one of the things that we did when we formulated these is we specifically created them to be intermediate sizes to our existing vaginal dilators. So for example, the smallest 2 rectal dilators are the smallest available on the market, and they can easily be used as precursors to this vaginal dilators for patients that need it for vaginal use. And then the other rectal dilators go in between the existing vaginal dilator sizes. So if patients are needing those other steps, they can certainly be using them as an adjunct. Otherwise, the rectal dilators are used rectally for patients that have stenosis or outlet dysfunction. They feature a bit of a bulb taper to provide a really gentle on-ramp to the anus because it is a smooth muscle, and oftentimes when something's going in where the person is used to things coming out, the anus can contract and provide a gate that can make it very difficult to be doing their dilator in service of defecation or penetrative intercourse if that's a goal. So that is the reason for that gentle taper, is to provide a gentle on-ramp, prevent overstretching of that anal sphincter, but still get the necessary use. And it can also be used very similar to our balloon training that we do in defecatory training, where the patient can be practicing expelling it. So how are you using these in clinic?
So I definitely have seen a lot of people with like outlet dysfunction, where we're using, kind of that expulsion model. And then also, working on being able to relax in the presence of something being there. I think you said it really well, the idea that like, okay, this is supposed to be exit only. Like we don't want things to be moving in and out of here. And there's always that little bit of trepidation there, but I think it's been a really, really valuable tool towards teaching teaching that strategy of being able to relax for a bowel movement or for penetrative intercourse. But we can also, in the clinic practice, what happens when we try different vocalization strategies alongside using the dilator. So whether we're having them do, shush when you push or moo when you poo, like they can, be seeing that, which strategy works for them in the moment.
Moo when you poo.
Yes.
I love it. Because there's so much more research being done in this space, but the effects of the glottis and on the breath pattern of the pelvic floor has become so paramount. There's another colleague of ours that's doing work on vocalizations that has worked with a lot of singers in that space too, and recognizing the way different mouth shapes and different glottis type pressures can affect the pelvic floor, and we can use that certainly as a tool of
Right.
getting the result that we want with our patients. So I love it. Moo when you poo. That's new. That's new for me. All right. Next is our wands. These wands are so special to me. I created these to be able to have either end used rectally or vaginally by all people of all different anatomy types. All the different colors indicate different functions. Purple is our original wand. It features this shape in order to allow for superficial mobilization of the perineum or superficial pelvic floor muscles in the urogenital triangle. It can also be used to hook underneath to puborectalis. And then this shape is very specifically helpful in reaching obturator internus on the lateral walls of each side of the pelvic floor. And then turquoise and blue are the same function, but different colors. They are a vibrating wand. They feature 10 different frequencies of vibration. Some are very soothing and very soft, which is helpful to stimulate blood flow and relax the pelvic floor muscles. And some of them feature different patterns. So the patient can self-select what feels best to them and use that to help relax the pelvic floor, introduce some blood flow so that they can be healing and working. It's been a game changer for chronic pelvic pain patients. And then yellow is temperature therapy. It can be placed in the freezer and will retain cold for those patients that respond really well to cryotherapy. And it can also be run under very hot tap water, and it will retain some heat for those that respond well to heat.
Yes.
Alicia, how are you using the tools in clinic?
So the wand is like my go-to, best bang for your buck type of tool because I feel like you can use it in so many different ways. Like you said, like you have the ability to access kind of either a vaginal entrance point or an anal entrance point to be able to get to different parts of the pelvic floor, but also just the different ways that you can orient and manipulate the wand to be able to work on, external tissues, tissues at the introitus, and then getting all the way to the deeper pelvic floor. When I'm educating patients about this, I use kind of like different shapes to describe where their wand is supposed to be. So when we're working on more of the entrance layer, I usually kind of have it to where like the hook is up this way. So it almost kind of looks like a little dinosaur shape. So flip them up the other way. So I actually use this way. So that way you have a little bit more leverage to be able to push down towards that like 6 o'clock spot, especially if you're using it for like perineal stretching or something like that. That lets the patient get a little bit more leverage there. And then if you flip it upside down, then you have that fulcrum point to be able to hook down into the deeper layers of the pelvic floor, into the bowl of the pelvis. And that's kind of my like snake position there is usually how I describe that because it looks like a little snake popping its head up out of the grass. But when we're working with patients, we'll talk about different positioning with their body. So whether, if they still feel like they're having to like really reach to get there with the wand, we'll talk about propping up with pillows, or we'll talk about even positioning where your legs are up the wall and you're lying back on your back to be able to reach, or even sitting with your back up against a wall with your knees bent up in front of you so that you have the ability to kind of leverage your body to be able to get to all of those different points that you might need to access.
Absolutely. I think lying supine with legs up on the wall or supported on a chair or couch that are in that 90-90 is my favorite position. It is a crowd pleaser, and I think most patients can get comfortable in that. And by having the feet supported, it turns the legs off so that the quads are not shaking and bouncing, trying to support them in that supine hook lying. And for patients that have a lot of mobility and don't mind being in that butterfly position, they can just lay supine and pillow under each knee on each side, so it's supported there. But I think that all of those body positions, having it available to them, because everyone has a day where things are just feeling a little not right, or they're feeling sore from something yesterday and they need to have those different body positions available to them. So it's helpful that we give them at least 2 to 3 so that they have it in their tool belt so that they can be optimizing on any given day. I love that. Next is our vaginal weights. These are also featuring our medical grade silicone. They start with the lightest weight being white, and as the color purple gets darker, the weight gets heavier. And vaginal weights were originally incepted in the 1980s in a metal form as a proprioceptive tool. And I think a lot of people are not aware of that in pelvic health. They are a proprioceptive tool to help draw attention to where the pelvic floor is in space, and they certainly can be used to help train patients where their pelvic floor lives to activate and to build strength and endurance. And there's a lot of different data that support building strength, building endurance, and also to supporting that coordination piece, because a lot of times we educate in clinic and we use proprioceptive input using tactile cueing and verbal cueing, and then the patient goes home and they don't have those right there on their shoulder like Jiminy Cricket physical therapy or occupational therapy, and they forget and they're bearing down and they're practicing their program wrong for the week. Vaginal weight, if they are bearing down, is going to come out and provide that instantaneous feedback to them. So it's a really powerful tool, even in patients that have very, very low tone. I think that's another misconception that a lot of people have, is that it's for strong people that are looking to get stronger in service of sports.
Yeah.
Yeah, they can certainly be used that way. But for a patient that's showing you a 0 out of 5 grade on the table, can still benefit from this if we position their body appropriately for them in supine or in seated, where they have support under the perineum and they can be practicing activating, or even in quadruped. In quadruped, the weight is going to tip forward into the anterior fibers of the pelvic floor, and they can get that feedback there as well. So they start at 25 grams. They go all the way up to 125 with the dark purple. It's very much like TheraBand in that it shows the patient their progress. A lot of patients like that, and it helps to progressively load the tissue as they get stronger. So how are you using these in clinic?
So I tend to use them more kind of as that like functional, the functional proprioception. So, with the people that have the, lower tone pelvic floor, maybe we're inserting a weight and we're working on, what's happening with whatever type of movement they might be leaking with, whether that's moving from like supine to a seated position, right? It gives them, okay, what's happening with my intra-abdominal pressure that's then like, doing something to my pelvic floor. Does my pelvic floor need to be doing more in this? I'll have people insert them and do sit to stands or squats or lunges. Again, just to give them that feedback of what does my pelvic floor need to be doing? Where might it be kind of lacking? Is it more one side versus the other if I'm doing lunges and, and alternating back and forth? So it's one of those ones where I feel like it takes exactly like what your digital exam is giving them in the clinic and bringing it up off of the table a little bit more easily than just following them around.
If only we could.
If only we could, but
Our patients certainly wish they could take us home with them. But they can take the vaginal weights instead.
Exactly.
So
The next
much
best
easier.
thing.
And it is one of those things where if there is a certain thing at home that's very specific, like unloading the dishwasher, as you said, it is very, very functional and in the moment. They can be practicing and using their breath pattern in that way and noticing, oh, when I'm lifting this load of laundry, I am holding my breath and bearing down. And then they can bring that feedback back to us because they'll notice that the weight slipped during that moment, and we can be working with them under those circumstances in clinic in service of all of those patient-centered goals.
Exactly.
Awesome. Any other thoughts on the Intimate Rose tools?
No, I mean, I just, I love how like varied all of these tools are. Like, I feel like for the vast majority of my patients, I can always find something that gives them a little bit of extra, again, another tool in the toolbox, another thing in their arsenal of things, to be able to give them some independence with working on their pelvic floor problems. And so it's always, been, I don't know, I think it's just been really nice to be able to have kind of a one-stop shop for all of these things.
We love being the one-stop shop. We will always keep trying to be the one-stop shop. And whenever there's feedback, whenever there's a need, we're always looking at how to fill it. We're always looking to innovate and create new things that just help make our patients' lives better and clinicians' lives better so that we can all move pelvic health forward together.
Yes.
Yes. And Alicia and I are going to be partying together in Boston at Combined Sections meeting next week. We will be doing more education. We will have all the tools. We'll be talking about what's new at Intimate Rose. But this video here lives forever. So if you're coming across it after the event, you can find Alicia doing amazing educational content on her website and on Instagram at the Pelvic Dance Floor. It's the Pelvic Dance Floor or the Pelvic Dance Floor?
The pelvic dance floor.
That Pelvic Dance Floor. I heard this interesting thing about different bands that people think are the XYZ, and it's not. Like Beastie Boys is just Beastie Boys. It's not.
Oh, interesting. I would have totally thought it was the Beastie Boys.
It is not. So you are the Pelvic Dance Floor. And then also on TikTok, which is the lighter hearted side of pelvic health. And Alicia is always doing the most creative and amazing content and reaching people that really need to hear it. So I'm so thankful for all the work that you do. And I'm so excited to see you next week in Boston.
Yay.
Yay. All right. Thank you.
Of course.